Thank you for this opportunity. My name is Mike Pezone. I'm part of Living Goods Advisory Services Unit. At Living Goods, we seek to reinvent distribution across the developing world through our own direct operations in Uganda and in Kenya, and in partnership with visionary NGOs, global businesses, and social enterprises. Today I'm going to talk to you, I'm going to introduce our model and talk a little bit about how we work with partners. In just last year, our entrepreneur network, over 1,000 strong, treated over 200,000 children and supported over 28,000 pregnancies. And while this is amazing progress and impact, this just isn't enough. Every day, 20,000 children die from lack of access to simple health products, products that cost very little. And 1,000 times a day, mothers of sick children have a decision to make. They can go to the local public clinic, spend money on transport, spend the whole day waiting in line, to find out 60% of the time they ran out of product. Another option is to go to a private clinic where they can expect to pay over 300% markup over cost, and even then they run the risk of counterfeit products. Typically 50% of the time, they tend to be counterfeit. So a very overwhelming statistic, hard to comprehend, a very challenging environment. But at Living Goods, we see opportunity. We see opportunity to build a sustainable business that saves lives, an opportunity to build a business that generates income for thousands of entrepreneurs and saves money for our clients, an opportunity to open up access. Here we have a quote from the late Professor C.K. Prahalad. If we stop thinking about the poor as victims and start recognizing them as resilient entrepreneurs and value-conscious consumers, a whole new world of opportunity will open up. This is how we choose to see the world at Living Goods. Living Goods is a network of independent, franchised micro-entrepreneurs that go door to door, teaching families how to improve their health and wealth while selling a broad assortment of products that can improve their lives. We have 4 key goals. First, save lives. We have a laser-light focus on easily preventable and treatable diseases. Second, improve livelihoods. We want to generate income for our agents and also save money for our clients. Third, increase access to innovations, products that improve the quality of life for our clients, products like solar lamps, clean cook stoves, clean burning fuel. And then achieve sustainability. Through our model, our agents generate an income. Our products are not donated. They make a healthy income, and that income is then contributed to our country programs. We do this by combining the best practices of 2 models, community health worker model and the best practices from franchise direct selling systems. As many of you know, the CHW model, locally embedded, volunteer-based, volunteers go door to door, educating families about health behaviors. Sometimes they have product, but typically they don't sell them, they distribute them for free. And then from the world of franchise direct selling, we take the highly systematized, highly replicable system. We combine the 2 for impact. Like I said, we have a laser-light focus on a short list of health conditions that drive 75% of childhood deaths. Mainly malaria, diarrhea, and acute respiratory infection. We also incentivize and support our agents to register pregnancies to ensure safe delivery in a facility. And then once that child is born, our agents ensure to identify newborns to ensure immediate detection of early infection and then encourage breastfeeding. And then within the first 1,000 days of life, we ensure micronutrition through the sale of fortified foods. And we do all this leveraging a franchising system. So I don't know if some of you are out of town, maybe you stayed at a hotel. A lot of hotels these days are franchised. 70% of restaurants are also franchised. The franchise sector in the US in 2005, $880 billion worth of output and represent 8% of jobs in the US. For entrepreneurs, it's a low-risk, high-reward environment. They can tap into a proven business model, and they receive support, training, marketing. The entrepreneur also has access to products, and we can aggregate buying power. A network of 1,000 agents can get better prices than an individual. And then there's benefit for the franchisor. The franchisees bring resources to the table. And they also benefit from a highly replicable and systematized model. So we like to think of ourselves as the Avon of Pro4 products. Avon, large company in 140 countries, did over $10 billion worth of business last year. There's a compelling analogy between when Avon was founded in 1886 and the developing world today. Highly rural societies, women are in need of some source of income, difficult to come by access of quality goods, and strong village ties. It's not a perfect fit, but it's the analogy that we see. And we, like Avon, want to achieve massive scale. Not necessarily for impact, not for lipstick, but for impact. Reversed it. So this is our value proposition to the client. Very important. Our products are affordable. We're able to shrink supply chains. In these markets, supply chains tend to be very long, with each reseller adding its own markup. We sell products to our agents at a wholesale price, who then in turn sell them for a retail price. We shrink that supply chain and pass the savings on to the client. Convenient. Our products are delivered right to their doorsteps. When you're operating on a tight budget, saving money on transport, big deal. And then availability. We never, ever run out of key health items. Malaria treatments, oral rehydration salts for diarrhea, and then quality. Absolutely no risk of counterfeits. So I'm going to dive in a little bit to the specifics of our system. I'm going to talk about agent recruitment selection, our broad product assortment, and a little bit about our mobile platform. But what I also want to have you guys take note, if this is something that's interesting to you, or any other organizations out there that are interested in replicating pieces of our model, we've developed systems and tools and processes that we're ready to share. So if something catches your eye as we're going through this, take note, reach out to me later. I'd be more than happy to share them. So recruiting and selecting top agents, absolutely critical. This is a picture of a freshly trained and equipped batch of agents. It's important that you get top performers. Very important. They're the lifeblood of your model. We invest a lot of time in recruiting and selecting them. And how we do that is we work with local leaders for a referral. The agents have to take a mobile literacy test, math test. They need to have a business background. There's an interview process. That interview involves a role play. And all this time, we're looking for agents that are charismatic, savvy, passionate, entrepreneurial, hardworking, well-connected, with a background in health. I mean, that's a very tall order. But finding these people is absolutely critical. Once we select these agents, they go through training. The initial training is 2 weeks. It's 1 part health, 1 part business. In the health training, they focus on learning how to prevent, assess, and treat health conditions. But they also learn when something's out of their area and they need to refer a client to a clinic. We also, in our business training, we focus on inventory management, selling, product knowledge. And then every month, we have in-service trainings that have different themes that we want to emphasize. So this is our business kit. It's absolutely important. It gives the agent everything it needs to start their own agent franchise. It includes health tools. So the job aids and tools that we've developed, flip books that you use with the client. On one side, it has a pictorial description of what's being discussed. In a certain case, it could be talking about the importance of iron folate when you're pregnant. And then on the back side, it'll have some words for the agent to read. We have other tools like dosage guides and referral books. The second part of the business kit is our business tools. And this includes inventory management tools, some marketing tools, some signage. And then what's also very important is the branding. The hat, the uniform, the bag. Branding is important pretty much in any market, but particularly so in developing countries. Here we have a picture of one of our agents going door to door in her community. You can see the bags front and center. Clients waiting for her down the way. It just relays the sense of quality, confidence, and trust. So what is in that bag? We carry some 80-plus products. We're constantly refining our product mix. Those 80-plus products come from these 4 categories. Prevention products. This will include our fortified foods and vitamins. We also have our health treatment products. These are products that our agents are always required to be in stock. This includes your malaria treatments, your oral rehydration salts. And then the ProPore innovations I mentioned earlier, the solar lamps, reading glasses, clean burning cook stoves. And then you might be sitting there asking yourself, why do you guys sell toothpaste and laundry soap? Well, these are products that people buy every day in these markets, and these give our agents a reason to go knock on the door. We call them our door openers. So you can get the door open by selling one of these products, and they're competitively priced, and then you can kick off a conversation about health. This broad product assortment also allows us to cross-subsidize products. So products that we want to see more of in the market, the high health impact products, like our oral rehydration salts, we can sacrifice receiving some sort of margin on them because we know another product in our product basket will make that up with a higher margin. So this is a picture of one of our branches. As you can see, it's a highly branded space in the community. It's one part meeting space for our agents and then one part warehouse. And this is the inside of the branch. This is one of our warehouses. It's where we keep product. This is our branch manager, Anita. She must have just received a shipment. She's organizing the products. It's critically important to have strong inventory management processes when you have a branch distribution system like this. We currently have 8 branches, over 1,000 agents. You need to track where your products are going. Because if you don't, or if you don't do it well, it's going to completely eat up your profits. So how do we get products from our headquarters to the clients? Every month, in line with our inventory management processes, we take a count. We determine how many products we need for each SKU. And a shipment is made each month to the branch. And a branch will support anywhere. Some branches are more than 100, some are a little less, but around 100 agents. And they serve an area of 10 kilometers in radius. They have 2 staff, equipment. The agent will come to the branch twice a week to restock. The agent is best positioned to understand what products she needs to purchase. So all of our products are demand-driven. All of our purchases are demand-driven. She'll support up to 200 homes and make up to 50 house visits a week. So she primarily meets clients going door to door in her community, but she will also have home store hours, and clients will come to her home. And then each link in our distribution system is connected by a mobile platform. So our mobile tools drive impact in sales. We're able to communicate directly with the client. We can send them promotional material about specific products and push clients to agents. We can also deliver health education and drive prompt treatment. So if an agent just made a sale for malaria treatment, that client gets registered. And I don't know if you can, you can't read that. But this text message here says something like, you purchased malaria meds. You're on day 2 of your treatment. You need to finish the treatment. There's one more day. You haven't killed all the malaria yet. This is a photo of a flyer for our Call Me for Help campaign. This is how we link clients to agents. And our clients highly value these. When I'm walking around with our community health promoters in the community, you see these pasted up on people's front doors. An example of our home store signage, always low quality, oops, always low prices. That was a good one. Always low prices, always top quality, and always in stock. If your child is sick, call me for help. Agent's name, phone number. Here's a picture of the home storefront, and you can see the agent's blue kiosk. That's where she keeps her product. And then another example of signage, listing the products we have in the middle. I know it's hard to see, and that week's promotion. So here I have a slide. I know it's real heavy on the words, but I just showed you a few photos, so I think we can handle it. It has the point I want to take away from this is that the comparative advantage of living goods compared to public health centers or private providers. And I've already talked about price. We're able to offer competitive prices because we shrink supply chains. Public health centers do have products for free. They frequently run out of stock. And private providers have product, but they have a pretty significant markup. And you're not exactly sure of the quality and you run the risk of counterfeits. We're always in stock of key health items. Stockouts are common at public health centers, and private providers also can run out. Our agents are always available. They're available by mobile phone, and they always carry products. This isn't always the case with public health centers or private providers. So it's for all these reasons our model delivers impact, adds value to clients' lives, and we want to bring this model to scale. We're opening up 4 more branches in Uganda, and we're moving into Kenya this year. We're opening up 2 branches in Kenya. And we're also opening up our advisory services unit, because to achieve massive scale like we want to achieve, we need to work with partners. We receive a lot of inquiries each week from social enterprises, NGOs that want to learn about our model, adapt a piece of it. And our advisory services unit was set up to respond to that need. I work with potential replicators, sharing tools, sharing our systems. And by midsummer, everything is going to be packaged and available online in an open source format for these organizations to use. So we work with partners in a knowledge sharing capacity. And then we also work with partners on technical assistance engagements. And currently, we're working with 3 partners. Our first client was Maurice Stopes in Kenya. Maurice Stopes is a pioneer in the field of family planning. And they came to us because they wanted to develop a product mix around their family planning product portfolio that would help their agents generate more income and thus ensure a more sustainable supply of family planning commodities. Our second engagement is with the Clinton Foundation in Peru. Here we have a photo of this agent network, which launched last January. Very innovative, fast-moving team here in Peru. Their agent network has grown to about 36 since January, and they're offering a variety of products. And we're kicking off an engagement with PSI in Mozambique just this week. So it's really an exciting time on our advisory services team. And we're just thrilled to be working with these partners. So in closing, I'd just like to say, we seek to reinvent distribution in the developing world. The way we're going to do that at scale is with partners. And we're looking for partners who see the same opportunities that we see. Opportunities to build a sustainable business that saves lives and generates income for the agents and saves clients money. So with that said, if any of these tools and systems inspire you or you're interested, feel free to reach out. Here's our contact information. Thank you.